Imagine this. It's late in the evening. The house is quiet. You're in your favorite chair, watching TV or reading on your phone. Suddenly, a heavy pressure creeps into the center of your chest, like someone sitting on your rib cage. The discomfort starts to spread toward your left arm, your jaw, or your back. Your breathing feels tighter, and a cold sweat appears on your forehead. If that moment ever comes, most people over 60 do exactly the wrong thing. They wait. They tell themselves, "Let me see if it goes away." They stand up, walk to the kitchen, take a sip of water, or lie down and hope for the best. Some are afraid to bother their children or call an ambulance. And precious, irreplaceable minutes are lost while the heart muscle is starving for oxygen. I'm speaking to you not just as a doctor from Golden Age Health, but as someone who has sat at the bedside of many patients who said, "Doctor, I thought it would pass, so I didn't act." A heart attack is usually caused by a sudden blockage in one of the arteries that feeds your heart. When that artery closes, every minute of delay means more heart muscle is permanently damaged. Here is the hopeful part. Having a simple plan for those first 60 seconds can completely change the story. One of my patients, Mr. Harris, 72 years old, survived with almost no long-term damage because he had rehearsed what to do when chest pain appeared. He didn't waste time arguing with himself. He followed his plan step by step. In this video, I will walk you through 7 practical techniques that you can learn, practice, and even post on your fridge. My goal is not to frighten you, but to give you calm, clear actions so your mind knows what to do even when your heart is in trouble. Doctor's golden tip. Once a month, close your eyes for 1 minute and rehearse how you would respond if chest pain started right now. Let us begin with something that sounds simple, but can decide whether help reaches you in time. How you call for help when your brain is under stress. During a heart attack, the heart is not pumping effectively, and the brain receives less oxygen. Within seconds to a minute, many people feel confused, struggle to find words, or even forget familiar information like their own address. This is not a sign of being weak or losing your mind. It is a direct effect of low oxygen and fear acting together. That is why your communication plan must be prepared in advance, when you are calm, not in the middle of an emergency. Start by writing your full home address, including apartment number, building entrance, floor, and any directions, on a card in large, clear letters. Add your main phone number, your emergency contacts, any gate codes, and access notes such as "use side entrance" or "dog in yard." Place a copy of this card next to every phone in your home and near your main sitting area. Next, make your phone as easy to use as possible when your hands are shaking. Set your local emergency number as the first speed dial on your mobile and on any landline you use. Many phones also let you place emergency contacts on the lock screen. Ask a younger family member to help you set this up if needed. If you use a voice assistant, practice saying, "Call emergency services" out loud so the phrase feels natural if you ever need it. Because many heart events occur at night, keep your phone on a bedside table, charging within easy reach. Avoid leaving it in another room or across the bed where you would have to stand up and walk to reach it. If you live alone or spend many hours by yourself, consider a medical alert device recommended by your doctor. Choose a waterproof model and wear it consistently, including in the shower and while sleeping, not only when you go outside. Finally, build a small circle of human support. Tell a trusted neighbor, building manager, or security guard about your heart condition. Give one person a spare key and ask them to check on you if your routine suddenly changes. your curtains stay closed all day, or they hear unusual sounds from your home, you are not being a burden. You are allowing others to help save a life. Doctor's golden tip. Tonight, place an emergency card and a pen next to your main phone and fill it in. On the internet, you may have seen messages saying, if you feel a heart attack coming, start coughing hard every few seconds to save yourself. People often call this cough CPR or cough resuscitation, and the idea sounds simple. Deep breaths and strong coughs to keep blood flowing to the brain. As a senior doctor speaking for Golden Age Health, I want to explain very calmly what we actually know about this technique and when it can be dangerous instead of helpful. In hospitals, doctors sometimes use a controlled coughing technique on patients who are already connected to heart monitors, with trained staff and equipment right beside them. In that very specific situation, a series of deep breaths followed by firm coughs can sometimes maintain consciousness for a short period while the heart rhythm is misfiring. The key point is that the medical team can see the heart rhythm on a screen and knows exactly what is happening beat by beat. At home, alone in your living room, the situation is completely different. You cannot see your heart rhythm. You do not know whether you are having a sudden rhythm disturbance or a full blockage of an artery, and you may already be lightheaded. For many seniors, trying to cough forcefully without guidance can drop blood pressure further, increase dizziness, or even cause a fall. Large heart organizations do not recommend cough CPR as a routine self-treatment for people at home who suspect a heart attack. So what should you do with this information? Think of cough CPR as something that might only be used if a cardiologist who knows your case has taught you personally, has written it into your emergency plan, and has explained exactly when to use it. For the majority of older adults, the safer, more effective priority is clear. Call your local emergency number, sit in the safest position you can, and use your breathing and medication plan that was agreed with your doctor ahead of time. If you have been told by a specialist to use a cough technique, the idea is usually to take a slow, deep breath and then make a firm, controlled cough from the diaphragm, not a frantic series of shallow coughs from the throat. But again, this should never be your first move unless your cardiologist has specifically instructed you, because you cannot tell on your own what is happening inside your heart. For most people watching this, the most powerful step is not learning a complicated cough pattern. It is sitting down quickly, avoiding a fall, calling for help, and using calm, paced breathing to keep your body as stable as possible until professionals arrive. Information on the internet can sound impressive, but your personal emergency plan should come from one place: the doctor who knows your heart. Doctor's golden tip. At your next heart appointment, ask directly, "Doctor, do you ever want me to use a cough technique at home? Or should I focus only on calling for help and breathing calmly?" Then write the answer on your emergency card. Many people have heard the advice, if you think you are having a heart attack, take an aspirin. That can be life-saving for some and dangerous for others. As a senior doctor with Golden Age Health, I want you to treat aspirin as a tool in a plan you and your physician have agreed on, not as a one-size-fits-all solution. During a heart attack, a fatty plaque inside a coronary artery can crack. Platelets rush in, forming a clot that may block blood flow to part of the heart. Aspirin mainly works by making those platelets less sticky, so the clot is less likely to grow. Large studies in heart units have shown that patients who received aspirin early in a confirmed heart attack had lower death rates and smaller areas of heart damage. If your doctor has said aspirin is appropriate for you, How you take it matters. When strong, pressure like chest discomfort or similar warning signs last more than a few minutes and you suspect a heart attack, you do not simply swallow a tablet with water and lie down. You should chew a regular tablet before swallowing. Chewing breaks it into small pieces, allowing faster absorption and quicker effects on your platelets while you arrange urgent medical help. The emergency dose often discussed is around 300 to 325 milligrams, usually one regular tablet or several low-dose tablets. But this is not safe for everyone. People with serious stomach bleeding, ulcers, liver or kidney disease, or aspirin allergy may need a different plan or be told not to use aspirin alone. Seniors who already take powerful blood thinners for atrial fibrillation, previous clots, or artificial valves must be especially cautious because extra aspirin raises the risk of dangerous bleeding. If your doctor approves an emergency aspirin plan, prepare it like any other safety item. Keep non-enteric coated aspirin in 1 or 2 easy-to-reach places, such as your bedside table and sitting area, and check expiry dates each year. Avoid storing tablets in steamy bathrooms or very hot cars, where heat and moisture damage medicines. And remember, even if chewing aspirin eases your pain, it never replaces calling your local emergency number and going to the hospital. It supports, not substitutes, proper treatment. Doctor's golden tip. At your next visit, ask your doctor to write a short aspirin rule on a card or on the bottle itself. So in a frightening moment, you and your family know exactly when to chew a tablet and what to do immediately afterward. When chest pain or heaviness suddenly appears, many people's first instinct is to lie flat on the bed or sofa and hope it disappears. Unfortunately, lying completely flat is often not the best position for your heart or your breathing. When you lie flat, blood can return to the chest in a way that increases the heart's workload, and your lungs may not expand as well as they should. For a tired, struggling heart, that extra effort can make symptoms feel worse. A safer choice for most seniors with suspected heart attack symptoms is a supported, half-sitting position. Imagine yourself leaning back at about a 45-degree angle, as if you were in a recliner that is partly raised. You can create this posture by sitting on a bed or firm sofa, propping your upper body against pillows or the wall. Keep your knees slightly bent with your feet flat on the floor or the mattress. This position helps reduce the pressure on the heart, allows the lungs to open more fully, and often makes breathing feel easier and less panicked. If you begin to feel very lightheaded, as if you might faint, your priority becomes preventing a fall. Do not suddenly stand up and walk around. Instead, carefully lower yourself to the floor or a firm surface while you still have some strength. If you can, roll onto your side, bend one knee for balance, and keep your head slightly tilted so your airway stays open. This recovery position can reduce the risk of choking if you vomit and keeps your tongue from blocking your throat if you lose consciousness. Clothing and environment matter more than most people realize. Tight belts, corsets, very snug waistbands, or high collars can restrict breathing and circulation. If chest pain starts, loosen anything that feels tight around your neck or stomach. If you are sweating, which is common during a heart attack, avoid wrapping yourself in heavy blankets. Overheating forces the heart to work even harder. Instead, keep the room cool and open a window for fresh air if it is safe to do so. Because moving is harder when you are scared or short of breath, it is wise to prepare your home ahead of time. Choose one firm, stable chair with arms in the room where you spend the most time. Think of it as your safety chair. Practice sitting down and standing up from this chair slowly, perhaps with a family member or physiotherapist, so your muscles remember the movement. In a real emergency, your goal is simple. Reach that chair, sit in a supported position, loosen any tight clothing, and then focus on breathing while help is on the way. Doctor's golden tip. Walk through your home today and decide exactly where you would sit if your chest suddenly hurt. Having that decision made in advance saves precious seconds later. When the chest tightens and fear rises, almost everyone's first instinct is to breathe quickly and shallowly. The shoulders lift, the chest feels tight, and the breath becomes fast and noisy. This is the body's fight or flight response, driven by stress hormones that prepare you to run from danger. During a suspected heart attack, however, that response is unhelpful. Rapid, shallow breathing actually reduces the amount of oxygen reaching your blood and makes your heart beat even faster, increasing its workload at the worst possible time. Controlled slow breathing is one of the few tools you can use instantly that affects both your body and your emotions. When you deliberately slow your breath, you send a signal to the nervous system that says, "You are not being chased. You are safe enough to slow down." The heart responds by gradually lowering its rate. Blood vessels relax, and many people feel the crushing fear in their chest begin to soften, even if the pain itself has not fully gone. This doesn't cure a heart attack, but it buys you calmer minutes while help is on the way. The method I teach my older patients at Golden Age Health is simple enough to remember even in a frightening moment. Sit in your supported position. Place one hand on your chest and one on your belly. First, notice which hand rises more when you breathe. Most anxious people see the chest hand move more. Our goal is to make the belly hand move instead. Now breathe in slowly through your nose for a count of 4, gently expanding your belly like a balloon. Hold that breath for another slow count of 4 without straining. Then breathe out through slightly pursed lips for a count of 6, as if you were blowing out a candle in slow motion. That longer exhale is not an accidental detail. The extended out breath activates the calming branch of your nervous system, which lowers heart rate and blood pressure over several cycles. Repeat this 4-4-6 pattern steadily. If you can, count out loud in a soft voice. This helps you maintain rhythm and gives important information to an emergency operator on the phone. As long as they hear you counting, they know you are still conscious and breathing. Like any emergency skill, controlled breathing is far easier to use if you have practiced it when you are well. I tell patients to choose a regular time, such as after breakfast or before bed, and practice 5 minutes of belly breathing every day for a few weeks. At first, it may feel strange or even a little tiring, but your body learns quickly. One of my patients, Mrs. Nolan, age 75, later told me, "When the pain came, my hands shook, but my breathing remembered what to do." Outside of emergencies, this same breathing pattern can gently support blood pressure control, sleep, and anxiety management, though it never replaces proper medication or treatment prescribed by your doctor. Think of it as a small portable tool you always carry. No batteries, no special equipment, just your lungs and your attention. In a crisis, you combine this controlled breathing with your other steps: safe position, emergency call, medications approved by your physician to give your heart the calmest possible environment to survive. Doctor's golden tip: set a daily reminder called heart breathing and practice the 4-4-6 pattern for just 5 minutes. In a real emergency, your body will already know the rhythm. There is a painful reality that many families learn too late. Sometimes emergency teams arrive quickly, but they cannot get to the person in need because the home is locked, the address is hard to see, or no one is there to open the door. As a senior doctor with Golden Age Health, I've heard paramedics say, "We knew the patient was inside, but it took precious minutes to reach them." When the heart is under attack, those minutes matter more than most people realize. That is why one of the first actions you should take, if you can still stand and move safely, is very simple. Unlock your main door. As soon as you feel serious, unusual chest discomfort, and before you become weaker, move slowly but purposefully to the front door. Unlock it, and if your neighborhood is reasonably safe, leave it not fully open but not tightly deadbolted. Then return to your safety chair or supported position. If you already feel close to fainting, call your local emergency number first and only walk to the door if the operator agrees it is safe to try. Making your home easy to find is just as important as unlocking it. At night, switch on hallway lights and, if you can, the porch or balcony light. From the street, your home should look like a lighthouse, not a dark, hidden corner. In daylight, ask yourself, if a stranger stood outside, could they clearly see your house number or apartment building name without squinting? If not, consider adding larger, high-contrast numbers near the entrance. This small change can help an ambulance spot you faster. For those living in apartment blocks or high-rise buildings, there are extra steps. After you call emergency services, use your second call to reach the front desk, security, or building manager. Tell them simply, "I am having a medical emergency. Please meet the ambulance and bring them directly to my apartment." Make sure your name is correctly listed on the intercom panel and that the buzzer works. These details seem minor until the moment they become essential. Preparation before any crisis multiplies the impact of these actions. Many seniors choose to install a sturdy key lockbox near their door with a spare key inside and a code that only trusted people. And, in some areas, local emergency services know. Others give a physical key to a reliable neighbor or building staff member. If you already use a smart lock or video doorbell, teach your adult children how to unlock the door remotely if paramedics contact them. Technology is most powerful when everyone in the family understands how to use it under stress. Noise and information also guide rescuers. Keep a small whistle or loud personal alarm on your keychain or bedside table. If you become too weak to shout, a repeated sharp sound can help emergency teams or neighbors locate you inside the building. Tape a simple medical information sheet on the inside of your front door or on the fridge. Your name, date of birth, emergency contacts, major heart conditions, regular medications, and any serious allergies. When paramedics enter and see this sheet, they gain instant, valuable knowledge that can shape your treatment. Finally, consider choosing a heart buddy, a friend, neighbor, or family member who understands your health and your plan. Agree on a simple rule, such as, if I call you twice and say very little, you should call me back immediately or contact my neighbor. This is not being dramatic. It is building a small safety net around yourself. Planning for emergencies does not mean you expect the worst. It means you are wise enough to make it easier for others to save your life if the worst does happen. Doctor's Golden Tip. Within the next week, do one small thing to make your home easier for rescuers to reach. Install clearer house numbers, test your door buzzer, or set up a key arrangement with a trusted neighbor. Among the medicines used in heart disease, nitroglycerin is one many seniors recognize. In the right hands and in the right situation, it eases chest pain by relaxing blood vessels and lightening the heart's workload. Used without guidance or in someone for whom it is unsafe, it can cause a sharp drop in blood pressure and delay proper treatment. As your doctor from Golden Age Health, I want you to think of nitroglycerin as a rescue tool that belongs only inside a plan you and your own physician have agreed on. When a coronary artery is narrowed and becomes more blocked or goes into spasm, the heart muscle beyond that point struggles for oxygen and often responds with pressure, tightness, or burning discomfort. Nitroglycerin widens blood vessels, especially the veins that bring blood back to the heart, so the heart does not have to pump against such high pressure. In some cases, this improves blood flow through a partially open artery and reduces symptoms. It does not dissolve a clot or cure a heart attack. It simply supports the heart while urgent care is arranged. If your cardiologist has prescribed nitroglycerin, timing and posture are crucial. At the first sign of chest discomfort that matches the pattern your doctor has described, sit down in your supported position before taking it. Standing and using nitroglycerin can lead to a sudden fall in blood pressure, dizziness, or collapse. The usual method is to place one tablet under the tongue and let it dissolve, because the medicine is absorbed quickly through the thin tissues there. Many people notice a brief burning or tingling sensation, or a mild headache. These are common effects and usually mean the medicine is active. Repeat doses must follow a personal plan, not guesswork. Many patients are told they may repeat a dose after several minutes if discomfort has not clearly improved, up to a limited number of tablets within a set period. But if your chest pain is new, much stronger than usual, or very different from your familiar angina, treat it as an emergency. Call your local emergency number rather than simply taking tablet after tablet at home. Never exceed the maximum number of doses your doctor has advised, and never use nitroglycerin prescribed for someone else. Storage is another detail that matters. Nitroglycerin is sensitive to heat, light, and air. Keep the tablets in their original dark glass bottle, close tightly, and avoid transferring them to pill boxes or plastic bags. Do not store them in steamy bathrooms or hot cars. Check the expiry date regularly and ask your pharmacist how often your supply should be renewed. If a fresh tablet no longer gives the slight tingling or headache you once noticed, it may have lost strength and should be replaced. There is also an important warning. Nitroglycerin should not be combined with certain medicines for erectile dysfunction or some lung and heart conditions, because together they can produce a dangerous fall in blood pressure. If you take any of these medications, your cardiologist needs to know, and you should carry a written list of all your regular drugs in your wallet or purse. In an emergency, this list helps paramedics choose what is safe to give you and what must be avoided. Finally, remember that nitroglycerin, like aspirin, is part of a broader emergency plan, not a substitute for getting to a hospital. If chest pain does not improve quickly after using it exactly as your doctor directed, or if it is severe, crushing, or accompanied by breathlessness, sweating, or nausea, call emergency services immediately. Do not drive yourself. Let professionals assess your heart with proper tests rather than guessing at home. Doctor's golden tip: bring your nitroglycerin bottle to every heart appointment and ask your doctor to read the label with you and confirm, "This is still the right plan for me." We have walked together through 7 key ideas: preparing your communication system, understanding when cough techniques are and are not appropriate, using aspirin safely if your doctor approves it, Choosing a heart-friendly body position, calming your breathing, unlocking and guiding rescuers to you, and using nitroglycerin only inside a clear medical plan. None of these steps replaces professional care. They simply keep you safer and more stable in the minutes before help arrives, when fear is high and thinking clearly is difficult. Heart disease remains a leading cause of death in older adults, but that does not mean the future is hopeless. Many seniors live long, active lives after heart events because they recognized symptoms early, acted quickly, and worked closely with their medical team. Preparation does not guarantee a perfect outcome, but it dramatically shifts the odds in your favor. A little thought today can mean more birthdays, more family dinners, and more ordinary mornings in your favorite chair. What should you do next? First, write or print your own heart emergency checklist and place it somewhere visible, such as on the fridge or by your bed. Include your emergency number, your address, the plan your doctor has given you for aspirin or nitroglycerin, and a reminder to unlock the door and sit in your safety chair. Second, share what you have learned with your spouse, family, or trusted friends so they know how to support you rather than panic. Watching this video together can be a powerful starting point for that conversation. Finally, remember that the best emergency plan sits on top of everyday heart care. Taking your medicines as prescribed, moving your body regularly in ways your doctor approves, eating in a heart-healthy way, managing stress, and keeping blood pressure, cholesterol, and blood sugar under control. These daily choices may not feel dramatic, but they protect the same heart you are preparing to rescue. Doctor's Golden Tip. Within the next 24 hours, choose one action from this video, perhaps making an emergency card, clearing your house number, or practicing your breathing, and actually do it. Knowledge only becomes power when it turns into action.